This is the top 9 supplements for arthritis. There are 6 common types of arthritis, and this is a confusing topic. When patients come in, sometimes I could tell they're confused, so I'm gonna go over them. Number 6, ankylosing spondylitis. This is a type of arthritis that affects the spine. Number 5, gout. Gout is a form of inflammatory arthritis caused by excessive uric acid. As a foot doctor, I see this a lot, especially big toe joint pain, ball of the foot pain, ankle pain can be very common. This affects almost 10 million people in the United States every year. Lupus. Lupus is a systemic disease and it's an autoimmune disorder. It can lead to osteoarthritis. Number 3, psoriatic arthritis. This affects people with psoriasis. I personally have psoriasis. I get dry skin on my scalp, on my face. I have to moisturize every single day. This is a very frustrating disease. It's estimated that 30% of people with psoriasis will develop psoriatic arthritis. Rheumatoid arthritis. This is an autoimmune disorder that can affect more than just the joints. According to the Arthritis Foundation, at least 1.5 million people in the United States have rheumatoid arthritis, much more common in women. This is when both your hands, both your feet are aching. And number 1, osteoarthritis. This is a damaged or injured joint. When you lose cartilage on your joint, at least 35 million people in the United States are affected, and probably way higher now. Typically, this affects older adults. Affects joints like the knees, hips, hands, and spine. So I said the top 9, but I'm going to include a couple bonuses for you. Vitamin D. Vitamin D is so important. It helps with everything, but surprise, it helps with joint pain, muscle pain, bone strength as well. Highly important. I won't spend too much time. Make sure to check your vitamin D levels. Magnesium. It's involved in 600 plus enzymes, also your muscles, your joints, your strength. Highly important. If you're deficient, certainly can contribute to your joint pain and arthritis pain. Number 11, HMB. This is beta-hydroxy beta-methylbutyrate. Very complicated, but especially in older people, this helps to prevent the breakdown of muscle strength. Muscle strength flexibility, very important in arthritis. Number 10, creatine. Creatine is perhaps the most important supplement for building muscle. It's naturally found in muscles and helps produce more strength, more high intensity exercise, heavy lifting. For my patients, almost immediately it helps their muscle strength and movement. If you're weak, if you're having a hard time moving around, strongly consider creatine. I have great videos on HMB and creatine. If you haven't thought about these, strongly consider them for anybody. They're safe, they're well studied with great results. Number 9, MSM or methylsulfonyl methane. This is a common ingredient in supplements said to help with joint pain. In one study, MSM improved pain and functioning compared to placebo in people with arthritis. The dose typically ranges from about 1.5 to 6 grams per day. It's sometimes divided into 1, 2, or 3 doses. You can typically find these supplements in most stores. I've had so many patients comment in these videos about how much MSM has helped them. Same with my patients personally. It's made such a big difference. Number 8, devil's claws. As a church-going person, devil's claw kind of scares me. It's not something I'd want to put in my body, but it is actually well studied. So if your arthritis is bad enough and you're not a superstitious person like me, it contains a chemical called harpogoside that has anti-inflammatory effects. Taking devil's claw may help with joint pain from osteoarthritis. Devil's claw was measured in a study against an anti-inflammatory drug and was said to work just as good, but it's a natural supplement. However, there needs to be more high quality studies. But again, this is one that patients say works well for them. You take about 600 milligrams 3 times per day. Number 7, avocado, soybean, unsaponifiables. Now, ASU referred to a type of extract from an avocado and soybean oil that may help prevent the breakdown of cartilage. It may also help repair cartilage. Clinical studies show that ASUs improve pain symptoms more than a placebo in people with osteoarthritis. The typical dose of ASU is 300 milligrams per day. Number 6, boswellia. Boswellia is also known as Indian frankincense. It's commonly used for pain caused by arthritis. Chemicals in this extract called boswellia acids have anti-inflammatory effect. Clinical studies have shown that boswellia extracts improve pain symptoms more than a placebo in people with osteoarthritis. Studies looking at the use of this for joint pain have used doses ranging from 100 milligrams once per day to 350 milligrams 3 times per day. The results were pretty good. I've heard a lot of people use it. I've heard a lot of positive feedback from patients. SAM, S-adenosyl L-methionine, is a supplement commonly used to help with symptoms of depression and osteoarthritis. Your liver can naturally produce SAM from an amino acid called methionine. It has several functions, including helping the production and repair of cartilage. When taken as a supplement, SAM can help with symptoms of joint pain caused by osteoarthritis. It can be as effective as an anti-inflammatory drug named Celebrex. In one study in 2004, Celebrex improved symptoms more than SAM after a month, but by the second month, SAM had about the same outcomes as Celebrex. It's usually taken in doses of 200 to 400 milligrams 3 times per day. Keep in mind that it can take a month, 2 months to notice some results. Number 4, now it's the more popular ones, chondroitin. Like glucosamine, chondroitin is a building block of cartilage. It may also help prevent cartilage breakdown from osteoarthritis. Many clinical studies have found that chondroitin can reduce joint pain and stiffness in people with arthritis. About 53% of people who take chondroitin have at least a 20% or greater improvement of knee pain. Chondroitin sulfate may also slow down the progression of arthritis when taken long term. Studies show that it slows down narrowing of the joint space when taken for up to 2 years. Joint supplements often combine chondroitin with glucosamine, but it's still unclear if taking a combination supplement is any better than taking one or the other on their own. The studies just haven't proved it. Typical dosages are about 4 to 800 milligrams per day, 2 to 3 times per day. Number 3, glucosamine. Glucosamine is a natural component of cartilage, a substance that prevents bone from rubbing against each other and causing pain and inflammation. It might also help prevent the breakdown of cartilage that can happen with arthritis. Many supplements aimed at treating joint pain include glucosamine. It's very well studied, but there's still a question of how it works exactly. There was one meta-analysis that found that products containing glucosamine hydrochloride don't do much to improve joint pain caused by osteoarthritis, but another one showed that it does improve this. When taking over a long period of time, studies generally say that it slows down the narrowing of the joint, so it won't build new cartilage, but can stop the degradation of cartilage. You can usually take about 1,500 milligrams a day, broken up into doses. Number 2, fish oil. This is omega-3 fatty acids, DHA, and EPA. They have anti-inflammatory effects. There's so much studies on omega-3 fish oils. This is something that I'm making sure to take more and more, and I feel it makes a big difference for me. I don't really have joint pain, but I work out. I feel it helps with my muscle strength and my inflammation. Typical fish oil dosages range from about 300 to 1,000 milligrams per day. I put some of my favorites down below, and check out my fish oil video. And number 1, turmeric. Turmeric is one of the most popular supplements for treating pain, including joint pain caused by osteoarthritis. Turmeric is so well studied. There's literally hundreds, if not thousands, of studies which all come to the same conclusion. Turmeric can be just as effective as an anti-inflammatory, has anti-inflammatory effect. It's relatively safe, although I go over the 10 potential side effects, especially as a blood thinner. It can help thin the blood, which for most people is a good thing. Some people, not a good thing. Dosages are about 500 milligrams 2 to 4 times per day for your joint pain. There's still a couple other things. The big secret is this. While supplements work well, in order, here's what works best for me. Number 1, muscle strengthening. Strong thighs, hamstrings, back, hip muscles. This makes such a big difference, and the easiest way to do that is resistance and strength training. But number 2, cardio. Cardio is so well proven as well. The more your muscles can keep functioning, the less they collapse, the less the joints rub. I go over a guide how to achieve this, starting a 30-day walking program. 99% of people with joint pain can benefit with the proper shoes, insoles, braces, orthotics, starting out 5 minutes a day, 10 minutes a day. Check that video down below. Makes such a big difference. Get that muscle strength going. That's the big secret. I'm telling you, the muscle strengthening, the walking, the inserts, the proper shoes, the orthotics. I have thousands of patients to see me for this joint pain. It works almost all the time. Seriously, check out that video. You won't regret it. Try the supplements, but really get your muscle strength and flexibility up.